Sir, Martha is the name of the mother and the child name is Betty.
Elizabeth, Betty. Okay, fine.
Okay, so can we start now?
One
Because
second.
there is no any name mentioned here. So I
No
can
problem.
assume
No
any name.
problem. Yes, of course. No.
Sir, Martha is the name of the mother and the child name is Betty.
Child's
Elizabeth,
name.
Betty. Okay, fine. Child's apostrophe S.
Okay, sir. So Martha is the name of the mother. Okay. So can we start now, sir?
One second. I'm setting up the show. Na?
Okay, sir.
Yes, you can start now. Yeah.
Okay, sir. Good morning, Miss Martha.
Good morning, nurse.
I'm your duty nurse, and from the 8 a.m. until 4 p.m., I'm here to assist your daughter. So, if you have any concern regarding her health, you can contact with me anytime.
Okay, nurse. Nice to see you. Thank you for your support.
So, I would like to get some information regarding her health condition. Like, could you please tell me how long she is suffering in this condition? Like, she has a wheezing sounds and difficulty in breathing.
Yes. Okay. Yeah, my daughter Elizabeth, she's just 3 years old. She has a chest tightness, wheezing, and a difficulty breathing. This has been for quite some time, maybe 1 to 2 hours, I think. And then I am literally worried. I brought here to this hospital. Yeah, she had for an hour and a half, something like that. And actually, she was running around in the garden when she started having difficulty breathing. The symptoms are now less severe than when they started.
Okay. So, may I know that like previously she had this kind of symptoms?
No, nurse, she never had such a problem before, and I don't know anything such ever occurred to her. The thing is, yeah, one more thing, I did not give her any medicine because I was not sure what to give her.
Okay, that is fine. Like you brought her here in the hospital, so now we can assess her condition and we can check her sign and symptoms, and according to that, doctor will prescribe medicine as per her condition. Okay, so may I know that there is any symptoms before, like she is feeling like shortness of breath, or there is any chest infection, or there is any wheezing sounds, like she is 3 years old. So in before 3 years she has any this kind of symptoms?
Um, okay, actually, my daughter is generally healthy. She hasn't been ill recently. She isn't taking any medication also, and she's perfectly fit and fine.
Okay, that is very good. If she is a healthy child, this is very important now in these days. Like we have to take care of our children, like they have to live a healthy life. So there is a very big role from the side of parents and as well as the healthcare professionals as well. And I want to know that, like, there is any family history in your family, like from her father's family and from her maternal side. Is there any problem like that before? You
Uh,
have any information like in the family there is anybody has asthma or this kind of symptoms?
Actually, no one in my family, okay, had any sort of such symptoms. Right. Let me clarify you. Yeah, my husband, okay, my husband had such symptoms when he was a child, asthma
Okay.
as a child, but no one has asthma or hay fever or eczema. That's for sure, nurse.
Okay, so let me check her vital signs. So we will give the findings to the doctor. If there is any unstable findings, so we will definitely work on that. And her vital signs are normal, and there is a mild wheezing sound. There is no cause of concern. Like we have to work out as soon as possible. Like people they have asthma, so they need a oxygen therapy as soon as possible. And also some people they require nebulization for the wheezing sound, so the wheezing sounds is mild, so we have to wait for the doctor. First, the doctor will come. Then they will assess more her condition. Then decided what the treatment they have to give. Okay,
Yeah,
do you
that's
understand that?
yes, of course, nurse. That's quite reasonable. And yeah,
And
um,
one and okay, and one more thing, there is maybe few investigations are required to diagnose her condition, and what we need to know that what is the exact diagnose for her. Okay, so we need to do some investigation, and I want after that doctor will discuss with you the treatment plan. What will be the treatment plan once once the investigations result will come? Do you understand that? Is there any difficulty? If there any problem in the understanding, you can ask me again.
no, nurse, that's quite clear. So there is no confusion. Everything is fine.
Okay, so until that time, you can wait in the waiting area, and once the doctor will be here, so I will inform you. Then I will call you. Then you can come, and doctor will assess your daughter's condition.
Yeah,
Okay, so in between, if you feel any difficulty, you can she you have any complaint, or she will have any difficulty in breathing, or she will have any more further symptoms or diagnose or symptoms you will assess or feel, so you can immediately contact with me. So I will assess her condition. And just if you have any other question, you can talk to me or you can ask me anytime, so I'm here to help you out.
yeah. Thank you very much, nurse. I really appreciate your concern. But how long should I wait for the doctor to see my daughter? I hope it would not be too late.
Yeah, doctor is not too busy, and there is a number of doctors are available. And for the quick examination with doctor, the treatment will be he will do the quick examination of you, and the treatment will be the nebulizer, like a salbutamol inhaler, and that inhaler. And once we will give the nebulization to doctor to your daughter, she will feel little better. And for that you have to wait for a little time, and once he will be here, so then I will come to you, and you have to come to the clinic, and doctor will assess your daughter's condition. So I hope you will understand that, because there is a like as for the patient's flow, the doctor will check your daughter as soon as possible.
Yeah,
Okay,
that's very fine, nurse. Thank you very much. I'll go back to the waiting room and wait for the doctor to come and see my daughter. Thank you very much, nurse.
most welcome there. You can contact with me anytime if you have any difficulty, or you feel to contact with me. Okay, thank you.
Yes. Yeah. So,
So can I mute back?
yes, of course. Once it is done, you can mute, right? Yeah. Now let us see. Yes. Right. Maria Muhammad. Yeah, you are serious. I can understand now. You have been there on the platform and you are interested to know many things. So I really appreciate. So I accept your application for subscription. Okay. Admission granted for Keptia from Ghana. I have one doctor and two or three nurses from Ghana who have prepared with me. Ghana, what's her name? She is already in Ireland. Ghana. Ghana. What's her name? Ghana. Yeah. So her name. Okay, fine. So admission is granted for you. You can approach me. You can ask me for the further details. Yeah. Now coming to the point, Rakhil Khurram. Yeah, Rakhil, this is the feedback for you. And you're very fast. You're very fast. Because of your fast, because of your speed, because you are very fast, because of your speed, you're doing many mistakes and you don't even know that you are doing mistakes. Okay? You don't even know that you are doing mistakes. Too fast. Faster than the speed of your brain producing sentences. So you have to focus on that particular area. Control your speed. I think you're fast in everything. So control that speed. It's a lifestyle. Okay? Speaking is a lifestyle. So that means you're speaking in your mother tongue also fast, doing things also fast, doing work also fast, everything you're doing fast, fast, fast. Okay? You're rushing. Be careful, don't rush. Don't rush. And next thing is, there is no sweetness in your voice. There is no sweetness in your voice, that feeling which melts my heart. Okay? That feeling I did not get. You're just like any other nurse. You're not giving that, you're feeling for me that you are a special nurse. Next time, when some other nurse comes, okay, I will say. But if a quality nurse speaks, next time when some other nurse comes, they'll say, where is that nurse? That feeling you did not give me. Okay? I did not get that feeling now. So what was the problem? Is you did not put your heart and soul into the speaking session. You only put your brain and mouth. You did not put your heart and soul into the speaking session. When you speak, the other person should feel that, yeah, the other person cares for me. They love me. They like me. They are ready to do something for me. They are spending so much quality time with me. They feel for me. They are sympathetic to me. Yeah, they are concerned about me. They want me to be better. So, like that feeling did not come to me. It did not come to me like that. Anything. It's just like a bus conductor giving a ticket and going off like that. Okay. There is no personal touch there. Okay. Personalization is different. Personal touch is different. Or you can say professional touch. A nurse is like an angel to the patient, they say, and half of the disease will be healed. Half of the disease will be healed. Yeah. By listening to the words of the nurse. So that feeling I did not get. I'm really sorry for that. You're only bothered about your English. You're only bothered about your OET. You're only bothered about your speaking. You're only bothered, I want to clear this OET. That's all. You're actually very selfish here. It is very clear that you are selfish. You only want to clear OET. You only want to get good marks in speaking. You only want to do a test. You only want to finish off these 5 minutes. You only are bothered about yourself. That's it. You're not bothered about the patient. That feeling I really did not get. If that feeling you get, that means you'll definitely get 400 marks. And I'm sorry, you did not give that feeling. Yeah, you will get 340 to 360 marks. Okay, borderline. But you may get even 330 also. Okay. So minimum 330. If I give, I'll give 330 for this one. Not more than that. Somebody else, maybe if lucky you, then you can get even 360, 370. But I cannot give you. Okay. Now control your speed and focus on the patient. Have that sort of flow. See, when I'm speaking, you can feel that Simon sir wants me to improve my quality. I'm not even looking at the screen. I'm thinking deep in my mind, how can I improve the quality of this girl's sentences, her presentation, her attitude, transformation, all these things I am thinking. You can feel that. Simon sir likes you, loves you, wants you to get the best results. Yes, you can feel that. But I was not able to feel that you are a special nurse for me. Why that indifference? Why are you not bothered about that patient? Why you are only bothered about the goods you want to deliver? I want to tell this, I want to tell this. Get lost, whatever happens to you, I'm least bothered. Like that it is. Okay? That's not right. Transform your attitude. Transform your attitude. When you give food to your child, you will not put something, 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 and as a machine does something, you will not do. Here, what you did was like a machine, okay, without a human heart and soul, just like a machine. One thing after another, one thing after another, it did. That's all. Like a washing machine, it will not think anything. Like a grinder, it will not think anything. That's it. So you did your job and you went off. Okay. I did not get that feeling that this nurse is a very great nurse. She's interested in my good health. That I did not feel. I'm sorry. So be careful. The problem is in you, in your attitude. Okay. You're hurrying. That also is a problem. Next, there is any symptoms before. Let me know if there is any symptoms before. What you're talking? Before means past tense, right? And symptoms means plural, right? I want to know if there were any symptoms before, not even are, is. There is, you are telling singular. It is not singular. It's plural. Symptoms. Symptoms, you told. Okay. Symptoms is plural. The word symptoms is plural. So there are, if it is present tense, but it is not present tense also. It is past tense because you use the word before. You use the word before. Try to understand this. Before, I want to know if there were any symptoms before. There were, not was, were. It's not singular. No? Symptom, there was. Plural, symptoms, there were. I want to know if there were any symptoms before. Next, okay. You're using the word okay. How many times you have used the word okay? It has been monotonous. It has been monotonous. Why monotonous? Why are you repeating time and again? Yeah. So, okay, okay. One time is okay. Second time, okay. Third time, how many times you will use? Avoid using multiple times. Okay. Next, is there any problems like that before? Again, the same style. So it is there in your blood. This mistake is there in your blood. Okay. Is there any problems like that before? Once you said symptoms, one you said problems. Problems, plural. Why is? It should be are, at least. Two mistakes you have done here. One is singular plural and present past. It's plural, not singular. It's plural, not singular. So there is there, no, are there. Then tense, past tense, before you used. You use the word before. Then it should be past tense. Okay. So it should be were there any problems like that before? Were there any problems? Were there any problems like that before? Not are there. The next one. You can immediately contact with me. You can immediately contact with me. Now try to understand. You can immediately contact with me. There is no need for contact with me. 1 second. Yes. Yeah, sorry for that. Yeah. You can immediately contact me. Enough. Why contact with me? You can immediately contact me, not with me. Okay. You can immediately contact me. Next. There is a number of doctors are available. There is a number of doctors are available. No, there are, not there is. There are a number of doctors or a number of doctors are available. Okay. There are a number of doctors or a number of doctors are available. In the beginning, you are saying are, and in the ending, you are saying there are. Sorry, there is a number of doctors are available. What is this confusion? Write 10 different types of sentences using this structure. Either use there is in the beginning or use are in the ending. Anywhere once. And these are your mistakes. Yeah. Now, you can open your mic, Rakhil. You can open your mic.
Yes, sir.
Yeah. You understood?
Yes, yes, sir. Yes, sir. I completely
Be
understand
very
that.
careful. Be very careful. These are all your suggestions. Yeah. You want to speak anything? You can speak.
Yes, sir. I'm very happy, sir. You are giving so much suggestions to me. And even while speaking, I didn't notice like I'm doing that much mistakes. So
Yeah.
I hope I will not do these kind of
That
mistakes
many
again.
mistakes, not that much mistakes, that many mistakes. Many mistakes is countable. Okay.
Okay.
Yeah. And you should also think about Simon sir nowadays. Okay. Simon sir also
Okay.
needs all your support. Okay. Right.
Okay, sir. Okay, sir.
Consider
Thank
something
you.
and talk to me personally. Okay. Right.
Okay, sir. Okay,
Yeah.
okay, sir.
Fine.
Thank you
Simon
very
sir
much.
is always there to support you people. Okay. Simon sir is
Yes, sir.
always there to support people. Right. Right.
Yes,
But
sir. Yes.
Simon sir, if he is happy, he will make everyone happy. If he is sad, he cannot make everyone happy. So keep Simon sir happy. Okay. Right.
Okay, sir.
Yeah,
Okay, sir.
fine,
Okay.
fine. Okay. Yeah,
Okay,
very
sir.
good.
Thank
You
you
have
very
improved a lot, but still follow all the suggestions which I have
much.
told
Yes, sir.
you. Yeah, right.
Yes, sir. Yes. Basically, sir, I have to consider on my speed. If my speed
Yeah,
is low, so I will get the time for the thing, and
yeah,
after that, I will speak.
yeah. Did anybody tell you, did your mother or father tell you, why are you very fast in everything? Did they tell you?
No, sir, I'm not that much fast.
You are faster. You are faster. That means they did not
Okay.
notice you or they love you too much. They did not want to comment. You are fast. So control the speed and slow. Okay. You will definitely win. Okay. I'm your teacher.
Okay,
I
sir.
can
Thank
tell
you
you
very much.
something. Na?
Yes, sir. Yes, sir. Sir,
Okay.
I'm taking all your suggestions and all your concerns. I'm taking positively. I'm not taking anything negatively.
Yeah. Fine. Very good. Thank you. Yes. Next one. Be ready. Abedya, be ready. I have a small meeting. Somebody came for me. I'll get back to you.